Hi everybody, I'm Lynn Mikula. I'm PRHC's CEO and I'm here in the diabetes clinic with...
Hi, I'm Jennifer Scriver. I'm one of the nurses here in the clinic, and thank you for being here with me today.
No, thank you. So this is a busy clinic, the diabetes clinic.
It is a very busy clinic.
And you have quite a broad scope. Tell me a bit about the kinds of patients that you treat here in the clinic.
In this clinic, we do see people living with type 1 diabetes, type 2 diabetes, gestational diabetes. It is the adult diabetes clinic, so that means 18 years and older. But fortunately, in this same hospital, we also have a pediatric diabetes clinic, so that's really nice.
So diabetes, of course, is a chronic illness that has acute episodes. So you've got both that long-term care and that episodic thing that drives admission. What have you seen in terms of changes about how diabetes might be presenting or what you're seeing through the clinic?
Well, definitely today is much different than it was, even 10 years ago. It is a chronic disease, but maybe are a little bit more advanced in that disease. We're seeing people, they're coming in, their A1Cs are quite high. Certainly a rise in new diagnosis of diabetes. Anything that's happening in an individual's life affects their diabetes. So, as the seasons change, stress levels, changing jobs, illnesses, you name it, it's going to have an impact on their sugars.
The people who work in the hospital providing care will inevitably encounter diabetes with a patient somewhere along the way or even somewhere in their day. It's so common.
Yes.
Is there one thing that you want everyone to know about diabetes, that you wish everyone just understood about the illness?
But diabetes is a very individualized disease. So, for example, what works for one person is not going to work for somebody else. And we always say here, something that I always think is that, yes, I'm a diabetes educator. I know how to manage the disease. I'm up to date on all the medications and the technology that we have today. But I always tell people, you are the specialist of you. Nobody knows you and your diabetes like you do. So I think to anyone in healthcare is listen to your patients because they know what works for them. We're very fortunate. We've got a very large team. We see a lot of patients.
Thank you so much for chatting with me today, Jennifer.
Thank you. Thanks for having me.